ready whenever you are.
Okay, my name's Alan. I'm going to show you and the board and the members how to use one of the two AEDs that you have on property. Okay, this is the AED that you have from Philips. It's going to be located at the concession stand and at, I believe, the other site. Okay, so they will be in the box, so if someone needs it, someone needs to be calling 911. You need to get the box out. Okay, this is your real one, just as it is, just like this. Parts that you have in here, so you're aware of. Okay, is this first response kit. So if someone starts to do CPR, this is the pocket mask, so they don't have to do mouth to mouth. If you don't know how to use it, you need to learn how. See someone, me or someone else, to show you how to use it. You also have in here is a pair of scissors to cut clothes, okay, including bras, because you have to get to the bare skin. There's also in here a razor, so if someone has a hairy chest, this will help you shave the area that needs to be done. A pair of gloves and a wipe, so in case they have a wet chest, you can wipe their chest. So that all stays in here, okay. And it's got its own little protective cover just as an extra thing, just like that. Okay, the other parts that you have, another pair of scissors, you have a spare set of pads. Okay, so if something fails on this one, or someone steals your razor and you need to do a wax on, wax off, you can do that with these. Okay, we'll talk about that. These all have expiration dates on them. Okay. It tells you when to call me like a month beforehand. The battery has an expiration date, okay? Different date. The pads are usually about 2 years. The battery's like 4 years, okay? How you check this every day, or someone should be checking it like you check your fire extinguishers. You know, once a month. Make sure this is what you're gonna see. This will be hanging in your box. This is gonna flash like every 15 seconds. If it's not flashing every 15 seconds, you need to be verifying it. Somewhere else, you should probably have written on the box the dates that the pads and the battery go, so that you don't run into not having them up to date. Okay, so that is your unit as it sits. So for your practice purposes for tonight, okay, this is part of what you guys own. Okay, you have a practice cartridge and a practice pad. So when you come in and you can practice and then show your proficiency, this is what you're going to do. You're going to take out the real cartridge by pressing the top here. It's going to talk to you.
Insert pads cartridge.
So I want you to put this one, the real one, back in. Look at the difference. Okay, front looks the same. But when you turn it over, yellow for practice, white for real. Okay, so when I put this practice one in,
insert adult training pads. Training. In case of emergency, remove the training cartridge and insert pads cartridge.
Okay, so
press the flashing blue button to choose training scenario.
Okay, so if an emergency comes up while you're practicing with this, you pop it out from the top, put the real one in, and you're ready to go. Okay, so we'll leave this like right here.
In case of emergency, remove the training cartridge and insert pads cartridge.
Okay.
Press the flashing blue button to choose training scenario.
So this is our practice pad. All right, basically it would be like this on a person, okay, on a real person, so you can see where the pads are going to go. They also tell you where to go in this training module. All right, so the first thing that you do, if this was a real event, okay, is someone needs to, one, make sure that the scene is safe for you to go up to the person. Two, you need to make sure that the person needs this. And three, someone needs to be calling 911. Okay, so how do we know that that person needs this? There's two things that has to be in play before you put this on someone. The person needs to be unconscious, and the person needs to be not breathing. Those two things alone allows you to put this on. Do not put it on if they are anything but unconscious and not breathing. Okay, so then the next thing you're going to do is, just like it says, you're going to pull this tab.
Begin by removing all clothing from the patient's
so
chest.
if you
Cut
needed to,
clothing
you could
if
cut their
needed.
clothing. Okay, remove. Bras have to be away, and because of the underwires, the next thing you're going to do is pull this
When
off.
patient's chest is bare, remove protective cover and take out white adhesive pads.
Okay, so these are the adhesive pads. They show you where to
Look
go.
carefully at the pictures
Okay, so this
on
one's
the white
telling me to put
adhesive
it on
pads.
the
Peel
top
one
right
pad
hand
from the
shoulder
yellow
of this
plastic
victim.
liner.
Okay,
Place pad
so I put it
exactly
there.
as shown in the picture. Press firmly to patient's bare skin.
Then I'm going to take the other one, and it shows me to put it down here, which is right
When the
here on
first
a real
pad
person.
is in place, look carefully at the picture on the second pad. Peel the second.
Okay, now
No
during this
one
whole
should
time,
touch the
someone should be
patient.
doing CPR.
Analyzing.
Okay, CPR could be done. You can work right around this person, even while it's
No one
analyzing.
should touch the
Okay.
patient.
But at
Analyzing.
analyze, I would just stop right then. But someone
Shock
should be doing
advised.
CPR.
Stay
Okay, so
clear
this is
of
saying that
patient.
it's in one of
Press
those
the
rhythms
flashing
that
orange
this needs to
button
shock.
now.
So you make sure everyone's clear, no one's touching
Deliver
the person.
shock now.
And then you press this orange
the
button.
flashing orange button. Shock delivered.
Okay, that's when the body would jump up and down.
Be sure
Okay.
emergency medical services have
If
been
you haven't
called.
already called,
It
make
is
sure
safe
someone
to
to call.
touch the patient.
Okay.
Begin CPR.
So the next thing you
For
have
help
to do
with
is start
CPR,
CPR.
press
All right.
the
So
flashing
this is
blue
this
button.
is not a CPR class, but what you can feel assured is that if you don't know what to do, you forgot what to do, you're in a panic mode, then press this little blue button.
Place the
and it
heel
will
of
walk
one
you
hand
through the
in
basics
the
of
center
CPR.
of the chest,
Very
between the
basics.
nipples. Place your
Okay.
other hand
And then
on top
so
of the
it'll
first.
walk you through.
Push the chest down
Okay.
firmly
It'll-
2 inches.
Okay, and these
Keep
and
time
then you
with
go
the
in
beat.
with the beat with the CPR, okay, which would be, basically, now I'm not tall enough to, you do your 30 compressions, which it'll count out for you, 30 compressions. All right, so you do your 30 compressions, and then it's going to tell you to do 2 breaths.
Pinch nose,
Okay.
tilt head,
So you tip the
and
head
give
back,
2
pinch your
full
nose, and you
breaths.
give 2 breaths, just enough to
Breathe.
make the chest rise 2 times.
Breathe.
Okay, and then you go
Continue
back.
with compression.
And this is going to do this, okay, 5 cycles, which is going to take about 2 minutes. Okay, I won't run it out the whole time, but it's 30 to 2, 32, which is the same that you do in regular CPR. Okay, then at the end of 2 minutes, it's going to tell you to stand back. It wants to
Pinch
reevaluate
nose,
and see if it
tilt
needs
head,
to charge again.
and give 2
It's only going to
full
charge
breaths.
if it's in one of those 2
Breathe.
rhythms that this thing reads. Okay, and just to reiterate,
Breathe. Continue with
the only time that
compressions.
we're going to use this, put this on a person, is someone who is not breathing, okay, and is unconscious. All right, so this is about the 4th time, so I'll keep talking a little bit till you can hear what the reevaluation does. All right, so during that time, you're doing the good CPR, okay? If the person
Pinch nose,
gets
tilt
tired, you
head,
can switch out
and
the
give
person
2 full
to do
breaths.
someone, to do the thing. If you don't want to do the breathing, then just do the compressions to the rate that it shows you.
Continue
Okay?
with
But
compression.
you have that barrier device in here, and you need to learn how to use it properly so that you're not afraid to use it. Okay? And so continuing with it, all right? It's going to do 5 cycles. This is, I believe, the 5th cycle. Okay? And then it's going to have you do 2 breaths.
Pinch nose, tilt head, and give 2 full breaths.
Okay, just enough to make the chest rise.
Breathe. Continue with compressions.
Okay, so maybe that wasn't the 5th time. I wasn't keeping track. Okay, so at the end of the 5th time, all right, it's going to have you stand back. So things that you want to make sure you're doing is good compressions, okay? Going to the beat. You want to go about half the depth of the person's chest. And
Stop CPR.
okay, so now
No
it wants to
one should
reevaluate.
touch the patient.
So you can have your hands ready, but not
Analyzing.
touching the chest, okay? Because if it says no CPR,
No one should touch
then you
the
should start.
patient.
I mean,
Shock
it says no
not
shot.
advised.
Okay, so now it's saying it's not
It
one of
is
those
safe
rhythms.
to touch the
So
patient.
now you want to get right
If
back on the
needed,
chest
begin
and do CPR again.
For help with
Okay.
CPR, press the flashing
So-
blue button.
Then you would start CPR again because we don't want to stop CPR for the minimum amount of time. So what I'm going to do now is we're done with our practice. So I'm going to hold this down for 4 seconds. That shuts off the machine. Okay. So now, so that I don't forget, Okay, if you want to reset it, okay, so someone else can do it, all you're going to do is peel this off, put it on the yellow pad, flip it over, peel off the other one, put it on the yellow pad, just roll this back in as neat as you can get. Okay, it'll never be exactly the same as the first time you take it out of the box, but you can make it neat. Okay, and then you put the cover back on by putting this bottom part into the two holes here. Put this up, lock it in. It's going to talk to you again, so just hold it down for 4 seconds again. Okay, so now someone else can practice. So you get through whoever's there to practice. If it's just one person, if it's 5 people, they can each do their own practice. And when you're all set, you're all done, you're going to put it back in the box. You pop out the top, push that to the side.
Insert pads cartridge.
Put the white one back in.
Adult pads.
Okay.
In case of emergency, press the green on-off button.
Okay. Well, we're going to press the green on button for 4 seconds to shut it off. Okay. Now this device is ready to go again for an emergency. Okay. So that is all set to go. What you do with this is you fold this up. There's a box that you have inside. It says training cartridge, training pads. You guys can probably label it better. You put this back in the box and then you are ready to go. Okay, now a couple of quick things that you need to know about the AED. If you go to put this on, and remember I'll put this on the chest so you can see. You went to put the pads on this person, okay? And right up here, there was something sticking out underneath their skin, okay? About the size of a pack of cigarettes. All right, does anyone know what that is? It's a pacemaker. Okay, we cannot put these pads on top of a pacemaker. You have to go 1 inch or so to one side or the other. All right. The good thing is that in America, most of the time they put the pacemakers over here. It's not in the way. But people from Europe and special cases, they'll put it over there. All right. Another scenario that can happen is you go to put this on, and right here they have a medication patch. Maybe they're trying to quit smoking. All right. So if that's a scenario, then you need to take that medication patch off. Use that wipe that's in here, wipe the skin, and then you can put the pad on here. All right, let's take a third scenario. You go to cut, and this person has a really hairy chest. Okay, so your option is use the razor that's in here, shave this area right here, shave this area right here, and put your pads on. Okay, but let's say that for some reason you can't find the razor. Okay, now remember I showed you that you had a spare set of pads in here. So what you do is you take those spare set of pads out, peel it out, open it up real quick, and you do a wax on, wax off, wax on, wax off with the other one. Now your area is clean, and you use a regular AED that's already in the container ready to go. And the fourth thing that can happen is if you have someone, they were sweating really heavy and then they collapsed, okay, and you determine that they were unresponsive and not breathing, and you want to go put this on to them, all right, just understand that you cannot put it on someone with a wet chest, either out of a pool or just sweating, because you'll have arcing and electricity and it's not good. So you take that wipe, you wipe the chest, wipe the whole chest, just the front, and then you can put the pads on and you're good to go. So those are the things that can happen otherwise that could be problematic for you, okay? So that covered all the general use of your AED and your trainer, okay? If you have questions, you can follow up with me. My phone number, you can't see it on there, but 727-688-3834. And you can get a hold of me and I can explain it to you. Hopefully you'll get a CPR class, because the two of them together is what you really need. Okay, there you go.